Hi, I'm Nicholas with Nightingale University, and this is my skills assessment video for a dressing change using sterile technique. My supplies for this video, as you can see here in front of me, I have first my wound with the current bandage already applied. I have here my biohazard waste bag. I have my sanitizer. I have my sterile dressing tray. I have my gloves, my new gloves, and a sterile, clean surface for me to prep everything. So to begin the skills assessment video, as you can see here, I have my Nightingale College attire on with the appropriate scrubs, my name badge for display for the patient. To begin the assessment, I'm going to enter the patient room and introduce myself. So to do that, I'm going to knock on the door and I'm going to open the door, close the door behind me for patient privacy, and introduce myself. Hello, I'm Nicholas. I'm here to change your wound. Can you please tell me your name and your birthday? I will confirm the patient's name and birthday and also look at the patient's wristband to be able to see that what they said matches. All right, so as I said, I'm Nicholas. I'm here to change your wound today. I'm going to be assessing it, and as I do this procedure, I just ask that you don't touch your wound and don't touch any of my supplies here. I need to maintain a sterile environment as I go ahead and assess this wound and change that there for you. Before we begin, do you have any questions? Okay, patient has no questions. I will go ahead and have my sterile tray here on a clean and dry surface. I brought this in from outside and I placed it here next to the patient so it's available. First thing, as I said, I will perform hand hygiene here before I even touch the patient. I will make sure that I have sanitized my hands. Once that's done, I'm going to take my clean gloves here and I will go ahead and put my clean gloves on. And I will begin assessing the wound. So I'm going to be removing the bandage, and to do so, I'm going to pull up and towards the center of the wound. I'm going to go ahead and do that with the grain of the hair to make sure that there's no pulling on the hair. And I'm also going to pull and remove the bandage parallel to the wound. So with that, I need to go ahead and assess the patient's wound as I remove the bandage. And what I'm looking for is any potential discoloration, any odors, any type of drainage. And then after I removed it, I can palpitate for any edema, seeing if there's any pitting or any sign of infection that the wound may potentially show. So I'm going to go ahead and begin removing it, pulling towards the center of the wound and lifting it up parallel to the wound there. And I'm going to fold it over and put it into the biohazard bag that I have here. And as I said, I'm assessing the wound. I'm looking for any discoloration, looking for the tissue for any granulation, any changes in color. And I'm also going to palpitate the wound for any edema, and that would be evident of any pitting that is going on there. Wound looks okay, so I'm going to go ahead and change my gloves and begin the cleaning of the wound. Go ahead and throw that into there. I'll go ahead and sanitize my hands again. And now we begin the sterile portion to introduce the items that are in my sterile tray. I have a pack of sterile gloves, which I'm going to grab with 2 fingers here. For the sake of the video, this is a used pair of gloves, but in the real world environment, I would go ahead and use a clean, unopened, sterile pair of gloves. I'm going to open these. Okay. With 2 fingers, I'm going to pick up the gloves, and to prevent any rolling, I will apply the gloves there and fold down onto my wrist there. And then same thing, I'm going to pick up the gloves from the inside here, and to maintain the sterile environment, so you can see it's folded over, I'm going to put my hand in and prevent any rolling and slide and fold the glove over there. Now, for the sake of maintaining the sterile environment, my right hand is going to be touching the patient. The left hand is going to be grabbing into the sterile tray, and it's going to maintain the sterile environment by not crossing or cross-contaminating from the wound and the sterile tray here. So as I'm assessing the wound, I am going to use the alcohol swab that I have here. I would want to ideally use a chlorine prep, but the kit that I had did not come with one, so in lieu of it, I'm going to use the alcohol swab. I'm going to take it from my left hand, drop it into my right hand, and I will go ahead and begin cleaning the wound. Starting from the inside, as I do one pass, I will start from the wound on the inside, work my way towards the outside. After one pass, I will go ahead and discard the dirty alcohol swab there, and go ahead and grab a new one, making sure that I'm not cross-contaminating with using my right hand to reach into my sterile environment, but using my left hand to do so. And then after I've cleaned the inside, I'm going to go ahead and work my way out, now doing one pass on the outside of the patient's wound. And as I'm doing this, I'm still assessing for the wound to see the tissue integrity as I'm cleaning. I'll go ahead and throw this into my biohazard waste bag. Next, I'm going to dry the patient's wound using the next item in my kit, which is a gauze. And I'm going to take my first gauze and I'm going to pat dry starting from the inside of the wound. And I'm going to do one pass of the inside of the wound. Then I'm going to take that gauze and discard it into my biohazard bag. Then I'm going to take the next gauze and I'm going to work my way around the outside of the wound, patting dry. So I've done one pass around the outside, taking the gauze, throwing it into the biohazard waste bag. I'm going to then assess the wound still. The whole time I'm maintaining the assessment on the wound, I'm looking for any discoloration, any odors, checking the tissue. Then I'm going to palpitate one more time, feeling for that edema there. That looks good. So now we're going to go ahead and place the Tegaderm on the patient, which my kit did not have one, so I have here a saran wrap in lieu of it. A clear wrap that we would use is very similar to the Tegaderm. I'm going to go ahead and open that. I'm now going to place this onto the wound. Place it onto the wound, and the actual Tegaderm has a border around it that I would then remove and throw into the biohazard waste bag. And once I've applied that to the patient, I can then begin to clean up the environment here, grabbing all the trash, throwing that into the biohazard waste bag. Go ahead and clean up my space here. I'm going to remove my gloves using the hook method here, and then I will roll this glove, reaching to the inside of my glove, toss that out there, and I'll go ahead and sanitize my hands. Then I'm going to check in on the patient, check to see how the patient is feeling, make sure that they had no pain during the assessment. Pain would be a telling sign of potential infection, but during the inspection and during the assessment of it, they didn't have any pain. I would let the patient know that the call light is available. If they have any questions, make sure they're in a comfortable position, and let the patient know I'm going to go ahead and chart at the nurse's station. I'll go ahead and chart the results of the wound change there, and I will go ahead and let the patient know that I can close the door for patient privacy if he chooses, or I can leave it open. and let him know he has a call light. If you have any questions, feel free to reach out. Your nurse will be available. Thank you.